Last year, approximately 58,000 cases of chikungunya and more than 1 lakh cases of dengue were reported across the country.
That was one of the worst epidemics of chikungunya ever reported in India.
This definitely rings alarm bells, and the centre has already asked states to begin aggressive awareness campaigns across the country.
So today, let's give you a quick rundown on both chikungunya and dengue, and more importantly, what precautions we all need to take. I am Dr. Sonia Lal Gupta.
And I'm Dr. Sameer Gupta, and welcome to Doctors on Call. Dengue and chikungunya are both viral diseases and are transmitted through the bite of a female Aedes aegypti and albopictus mosquito. Common symptoms for both infections include high fever up to 104 degrees Fahrenheit, body aches, headache, and a rash. Very often, patients with chikungunya also have joint pains that usually affects hands, wrists, and ankles. The joint pains can be very severe and disabling and can last for weeks or months. Sometimes it can even last for years. Now in dengue, we see a fall in platelets usually on the 3rd or 4th day after the fever breaks. And that is why it is very important to avoid NSAIDs like ibuprofen or diclofenac. These medicines cause the platelets to further drop and can increase the risk of bleeding. The dengue shock syndrome is a rare but a well-known complication of the dengue infection and can sometimes lead to death. Here, not only is there a severe fall in platelets, but the virus affects the blood vessels, causing them to leak. The leaky blood vessel causes collection of fluid in the lungs and other parts of the body, causing a severe drop in blood pressure. Now, deaths due to chikungunya are rarely seen, but people affected with chronic illnesses like diabetes or asthma are at a higher risk of getting complications. But just in general, there are some important things you need to remember. Now, some populations have to take extra care. Young children, especially below 1 year of age, pregnant women, anyone above the age of 60, especially when they have health conditions like diabetes, high blood pressure, severe asthma, and kidney failure. Now, it is also important to look out for warning signs like difficulty breathing, confusion or loss of consciousness, severe abdominal pain, less production of urine, bleeding in the gums, continuous vomiting, blurry vision, as these problems may be a sign of severe fatal complication and need urgent treatment at a hospital.
Now, the best way to prevent any of these diseases, be it chikungunya, dengue, or even malaria, is to avoid being bitten by the mosquitoes altogether. Mosquito repellents play a big role in helping protect us from mosquito bites. The WHO recommends repellents containing DEET, IR3535, or icaridin. The Center for Disease Control has deemed DEET containing repellents safe to use in anyone above 2 months of age. Plant-based repellents like citronella and geraniol can also be used. Apart from using repellents, other precautions include wearing full-sleeved clothes, making sure there is no stagnant water lying around, especially in pots and coolers, as both these mosquitoes breed in clean water. Since these mosquitoes are most active early morning and late afternoon, avoid staying out during these times if possible. The website for the National Vector-Borne Disease Control Program gives you detailed information on how you can protect yourself and the surroundings from mosquitoes.
Now, Dengvaxia is a vaccination for dengue, but it is still in research phases and is yet to be introduced in India. And for chikungunya, there is no vaccination.
Also, there is no scientific evidence for use of goat's milk or papaya leaves for either of these infections. So please go to the doctor if you have any of the above symptoms.
Absolutely. Remember to protect yourself and your loved ones. That's all we have time for today. See you next week.